This is a session on becoming and maintaining board certification. I know a few of you were in the room just before hearing about MOC Part 4. Not going to spend a lot of time on the MOC Part 4 questions, but just enough that we can address that. And then at the end of the session, I'll be around for a little bit, and Dr. Greaves will be around to answer questions. I'd like to introduce, first of all, I'm Dr. Natalie Hartenbaum. I am currently the Vice Chair of Occupational Medicine on the American Board of Preventive Medicine. Sitting next to me is Dr. Bill Greaves, who is the Executive Director of ABPM, and sitting in the back of the room, wave Denise, is Dr. Denise Kessler, who is current Chair of the American Board of Preventive Medicine. So, and we lost Claire.
We're giving the MOC exam right now, so she's going back and relieving the proctors.
So, in other words, there's a lot of people here from ABPM that you can ask questions to. The exhibit hall opens tonight at 5 o'clock. Please make sure you do go to the exhibit hall, and you can get more of your information, more of the questions answered on ABPM, becoming board certified at their booth. So we'll get that started with that. What do you need to do? Well, first of all, what does ABPM do? ABPM has a mission statement, and we certify physicians in the specialties and subspecialties and some kind of related specialties of preventive medicine. We also encourage and advance the study of standards of practice. We work very closely with, we work under the direction of the American Board of Medical Specialties, the American, the ACGMA, Accreditation Council of Graduate Medical Education, ACGMA, and we have to follow a lot of their criteria. So over the years, we've heard complaints of, why are you making me do this? Usually it's not because we're making you, it's because someone else is making us make you. So please keep that in mind as I go through some of these requirements. What is our purpose? To maintain high standards. It is not meant to be an easy exam. So for those of you who hear the exam is really, really, really hard, it's not really, really, really hard. But it is meant to test your knowledge and your ability to practice and be competent occupational medicine physicians. We do administer the exam, and that's probably one of the biggest pieces that we do. And we do also the MOC, the recertification, and some other pieces that we work with other specialties. ABMS, American Board of Medical Specialties, they define board certification. And it's what we have to go by. The individual has chosen to achieve expertise in a medical specialty or subspecialty, meeting the profession-driven standards and requirements. So this really is a profession-driven, but there are very specific criteria that must be met in order to declare yourself as being board certified. What are the medical specialties? Well, we're growing. The basic primary specialties in preventive medicine are aerospace, occupational, and public health and general preventive medicine. There are some subspecialty areas in clinical informatics, relatively new, medical toxicology, undersea and hyperbaric medicine, and the most exciting new one is addiction medicine. A little over a month ago, the announcement came out, the addiction medicine, American Board of Addiction Medicine, would now be turning over the responsibility for certifying diplomates in addiction medicine through the American Board of Preventive Medicine. Right now, we're working very, very diligently, very, very hard, very, very to get ready to give a board exam, hopefully within the next year or two. It really seems to be a right place for addiction medicine to exist, given how much work we do with either MRO, pain management, or other issues that really do touch on addiction issues. So that's pretty exciting. Now, there's several pathways to board certification in OCMED. How many of you in the room are in a residency program? Okay. You're going to make my life easier when I review your application. How many of you are going to apply through a special pathway, if you know what that is? Anyone know what a special pathway is? Special pathway means that you are already board certified in one of the other preventive medicine specialties. So your aerospace, your preventive medicine, public health and general preventive medicine, and you want to certify in occupational medicine. That's your special pathway. It's a second certification in a preventive medicine specialty. We then have the alternative pathway, open only to those who graduated medical school prior to January 1st, 1984. That's essentially a practice pathway. So I think there may be a few of you in the room who meet that criteria. Most of you probably don't. And then there's a complementary pathway, which is a little more detailed, and we'll talk about that. where individuals who have a certain number of training years, maybe they're not board certified in another specialty, but they have achieved training, they have also had additional training in occupational medicine, and meet other criteria, can sit for the boards. Thank you. I know I'm losing it already. I just started the week. So the complementary pathway, what does that require? At least 1 year of clinical training. So you've done your internship in something else. You've done your internship and a second year. You have done the coursework in the essential core courses of occupational and really preventive medicine, the biostatistics, the epidemiology, health service management and administration, and environmental health. And then 2 of the last 5 years, you're essentially in full-time practice in occupational medicine or the specialty in which you wish to apply. So you have to have that clinical year, you have to have the core courses, and then you have to have the currency of practicing in the specialty. And then the alternative pathway also has some very specific practice requirements on a very detailed chart, which is in the ABPM's website. We can go through if you have specific questions. And that's the review charts. And really, I think I have I don't have a slide on that one. But, you know.
Just, I apologize for my editing.
I thought you changed that.
I made a mistake on this. The website or the URL is where it says publications, it's public. So it's the main website, www.theabpm.org/public, PUBLIC/infobook.pdf.
Or the easier way of doing it, for people like me who are just lazy, go to www.theabpm.org and then look under resources. There's also a heading which is called Becoming Board Certified. If you go under the Becoming Board Certified, it will give you all the information that you need. So you have to memorize the exact URL. So when you're taking your certifying exam, there's 2 parts to that exam. The first is the core. The core is the essential knowledge for all preventive medicine specialists. It will include maternal fetal medicine. It will include behavioral health. It will include epidemiology, biostatistics, mental health, behavioral health. So everything that you're going to need to know, there's still that core content in preventive medicine, and that's the morning exam. The afternoon exam is your specialty specific. So for occupational medicine, the afternoon exam is all OCMED. For aerospace, the afternoon exam is aerospace. Each section has 150 questions. And for each segment, you're given 3 hours to complete. Some people take all 3 hours, some take an hour. Doesn't mean that people who do it in an hour are doing better. Just means that they're doing it faster. The exam is all computer-based. So you go to a Pearson Learning Center, you register for the location. It's given over about 200 locations, and it is a proctored exam. But it all is computerized. Again, this is the general knowledge, the core section. About 15% is health service management, 35% epidemiology and biostatistics, 20% clinical preventive medicine, 12% behavioral, and 18% environmental. There are the core exam committee is made up of specialists in all 3 primary preventive medicine specialties. So the core exam has occupational medicine docs, it has aerospace docs, it has public health docs, to make sure that that exam has a broad range of questions from all 3 of the specialties. So it's not just going to be a public health test or an aerospace test, but it really does cover all 3 of those specialties. Now for occupational and environment, or for occupational medicine, you are not boarded in occupational and environmental medicine, you're boarded in occupational medicine, of which environmental medicine is a component. So about 20% is prevention, exposure control, hazard recognition and control. About 60% is clinical patient care, and we'll talk about clinical patient care in a minute. And about 20% is more administrative. Now, one of the things we need to keep in mind for clinical practice, I know we discussed it at the House yesterday, we've got to be very careful that those of us that are doing population occupational medicine are still in a clinical specialty. Our clinical practice is more of a population. It is a workplace. It is the employees. And if we only think of clinical as hands-on, we're going to find ourselves running into licensure issues in the future. So even though we call it clinical, it's more of a how do you handle the patient who may or may not be standing in front of you. When the exam is put together, there are things that look like toxicology. They look like certain other topics, but they're really cases. How do you manage this situation? It's not the recall, it's not the evaluate, it's not the interpret, but it is a true situation. You have 12 patients who suddenly come to you and say they're complaining about itchy eyes and purple fingernails. What is the most likely exposure? That's a clinical case. So we ask not just, do you know, can you spout back the different chemicals that cause purple toes, but then how do you put that all together and decide what you do with that patient or employee? Maybe they're not patients, depending on the situation. What types of questions are there? Yes, there are some recall questions. Not a lot, but there are some recall. A lot of interpretation where you're given information, you're asked to evaluate the information you're given and come up with what's your next step. And then problem solving. Again, that's that clinical situation. Walk it through. What do you do? How do you get there? What's your outcome? Each question is composed of a STEM. And if you like writing questions, after you take your board exam, we'd love to have people who want to help us write the exam. We just did a real significant overhaul this year. But it's a STEM. The STEM is the statement. It's the first part. And then there's 4 choices. We do not use K questions. For those of you who remember the multiple true-false questions. Is it A and B, B and C, A, B, C, D, or none of the above? No. It's one best answer. And keep in mind it is a best answer. Otherwise you're going to be like me, and you're going to overthink the questions. And it's going to be, well, C is also right. Yeah, but A is the better answer. And again, don't overthink too much. There's 4 responses, one of which is the best correct answer, and the other 3 are called distractors. Distractors are reasonably possible answers, but they're wrong. So read the questions carefully. We do not put trick questions on the board. We do not do. It is not most likely to undo and overdo. So there's not a lot of negative, positives. We really work very hard to make the questions very, very clear and easy to interpret. They may be complicated, but they're not meant to be confusing. What are the resources? And we have the list of resources in your study booklet. This may be updated next year. We met with the residency directors on Saturday and asked them what books and resources they feel are essential. So we may be modifying this. We are trying to get as many of our questions as possible from these books. In other words, make sure you review these books. It doesn't mean you shouldn't look at other resources. But these books we found are going to have most of the content that we're going to feel is essential knowledge and therefore eligible for testing. Also a number of websites. Now, certainly you can look and say the ATSDR's website is gigantic, and it is. So I'm not going to say think about what we're thinking. But when we're looking about risk assessment, we're talking about exposure control. That's the kind of document you're going to look for in that pages. OSHA, what are the OSHA regulations, the significant OSHA regulations that you're most likely to come in contact with and have to deal with? For the ACOEM website, what are the position papers? What are the guidelines? That's the kind of content that we feel is essential knowledge for an occupational medicine physician. If you see something that says 1 in 100 million thousand people may ever see this, chances are we're not going to test you on it. So it really is looking at what is the essential knowledge. Doesn't mean ignore the stuff that you think is under the, a little bit less common. It's just not going to be that super esoteric stuff. And the CDC, OSHA, and then JOEM. When the exam is made up, it's generally created mostly in March. So we're not going to pick a journal article that comes out in June for a test that's given in October. It's going to be a really high-level, essential journal article for it to be included on the exam. And it's generally about 2 years back, up to about 6 months before the exam. So you don't have to worry about reading every single JOEM that's ever come out. Why do we find out what's in the article? The study guide has a very nice outline of exam content. It breaks down the different topics, and you can find that through, again, www.theabpm.org. These are your 2 booklets, the booklet of information and the study guides, some sample questions to give you an idea of how the questions are constructed. What's the timeline? Well, the application process has now opened. It opened on March 1st. So the application is online. You can complete it and submit it online. You must submit it by June 1st to avoid the late fees. The examination is given over a 2-week period from October 3rd to October 14th this year at those over 200 Pearson Learning Centers. The exams are scored. It is a very scientific way of scoring. We do not say, okay, we're going to scale it based on everybody who took the exam this year. There's a standard that was set. There was a determination of what is essential knowledge. We then look at each and every question. I think we have this. Each and every question looks at it, and we look at those of you who understand P-Val and P-Vis and all those kinds of great things. It tells us how well each question does. Are the strong candidates getting this question wrong? If the strong candidates are getting this question wrong because they performed really well on everything, but this question they didn't do well on it, we're going to look at that question. And we're going to say, did they overthink it? Or is it a really good question and we have no idea what happened? If we look at that question and, you know what, it's not a good question. We have the wrong response. And yes, occasionally a question will sneak on with the wrong answer or another answer that really is just as good. Those questions will be dropped and taken out of scoring. If we have a question that nobody gets right, we're going to look at it and say, okay, what's wrong with this question and how do we fix it? So these questions really are looked at very closely to decide whether it's a good question or not. If the questions are dropped, everybody's score completely rescored. So again, it kind of recalibrates where things go on the curve. The full board, so the initial key-val review is just the occupational medicine for this test, just the OCMED committee. After that, it'll be the full board, and then we decide on the pass point, and it votes on it, and letters go out. Like I said, scores are equated to a standardized score. We standard set every few years. Occupational medicine just standard set this past year. And then we make sure we use some similar questions and some questions that have been used occasionally to make sure that we can compare to prior years on the questions. And the idea is that we make certain that the exam is not harder. So the exam may be harder from year to year, but the scoring criteria are the same, so you should pass the same amount. Not the same amount of people, but the same level of difficulty from year to year. And then we notify all the candidates by mid-November. You get, I think it's an email that goes out.
Yes.
And you go to your website and you pull it up. And I know last year there were some questions and glitches, but usually it works really well. And the certificate, you receive a test that all requirements of the certification process have been met. It's dated January 1st, so you take your exam in October, you're notified in December, and your certificate is dated sometime January 1st of that following year. And it expires January 31st, 10 years later. We talk about how do we score the exam. We primarily look at the reference group. The reference group is first-time test takers, U.S. graduates of a residency-trained program. The reference group is who we expect to do the best. Then the other groups, the non-reference groups, are multiple test takers, non-residency-trained, non-U.S. medical school graduates. And that's all other pathways. The results are not used to make that pass-fail decision. So everybody is looked at together. So we're not easier or harder on one group or the other. It's just that we look at the reference group, and we hope that the reference group, the residencies are training what we think they're training, and if there's a disconnect, then we've got to figure out why. This is the pass rate from this past year. I mentioned the reference group. The reference group, 97% passed. Okay? So those residency trained, GPM 98%, and aerospace was 83%. Now, when you go over on the slide, 85% was the actual total pass rate for occupational medicine. What that meant was that other group included multiple test takers, non-residency trained, non-U.S. or Canada, forgot to mention Canada, trained physicians. Can you retake one part of the exam? You have to pass both the core morning and the specialty afternoon in order to consider as having passed the entire exam. If you fail only one part, morning or afternoon, you only need to retake that one at the next offering. If you want to become certified in a second specialty, you're board certified in aerospace, you want your ACOEM boards, you have within 7 years to go take just that specialty component. Maintenance of certification. Okay, that's continuing certification. It is not an ABPM requirement. We are required to do that. It is a changing landscape. We are following, okay, what we need to do. It provides a structured way for diplomats to really understand and continue with understanding what the specialty key areas are. It is under the auspices of ABMS. As ABMS changes their requirements, we will change our requirements. You probably heard about MOC being once in 10 years to twice in 10 years. We're going to talk about patient safety initiatives. That's all new. We have to follow what we're told to do within reason. We have a little bit of flexibility, a little bit of leeway, but we still need to meet the criteria that are set forward for us. MOCs in the Affordable Care Act. It's also becoming a very important issue in state licensing boards. What are the 4 parts? Part 1 is just professional standing. Have you maintained your license active, unrestricted? Have you done lifelong learning? Have you done the appropriate CME? The amount of CME may vary depending on when you are board certified. Part 3 is the recertification exam. I know it's being given right now, which is why some of the ABPM staff isn't there. And then the assessment of practice performance. I think Denise talked about that last hour, and that is really look at what you're doing. Look at what you're doing well, look at what you're not doing as well. Figure out how you can improve. Do whatever it takes to improve. Reassess. Did I improve on what I wanted to improve on? And then submit that. Each specialty uses the Medical Specialty Society. OM uses ACOEM. The Preventive Medicine group uses ACPM, and Aerospace uses asthma to work with the specialty and the diplomats from that specialty for the Part 4 MOC. You must complete all 4 before your 10 years are up, and all 4 parts must be completed during that 10-year cycle. So we talked about the professional standing, up 250 hours over the 10-year span, and at least 100 hours must be in ABPM approved activities. It's a little hard to find the list of ABPM approved activities, but I think it's getting better.
Sure.
If you have any problems finding ABPM approved activities, feel free to call Bill or myself, because it's a little bit tweaky on how you have to do this drop-down search. I know I had someone call me a couple weeks ago, and when we walked through, it was like, oh yeah, there are a lot of things available. ACOEM. Every session here is MOC approved as long as you take the questions and answer those questions. And then 30 hours at least every 3 years, breaking it down. It used to be you have to do it all at once. No, you have to break it down at least 30 hours every 3 years. And then 45 hours of other. So it doesn't all have to be ACOEM or approved, ABPM approved CME. It can be other types of CME as well. Part 4 is that exam. There is 100 questions. It's really focused on what is most relevant, what is essential to the practicing occupational physician who may be 10 years out from training. It's specialty only. You can take it any time within 3 years prior to your expiration. If you do not complete it prior to the expiration of your certification, you are no longer board certified. And again, if you take it after that 10 years is over, you can be recertified, but you would have that gap time where you're not considered as certified. And we talked about the practice improvement. That's in the 10-year cycle. It's every 5 years. Is that what every 5 years. We just changed that for Part 4. The other thing that is new is patient safety. It's a new component of the MOC. And I think there are about 7 or 8 sessions at AOHC that are approved as patient safety modules. We'll be getting more and more on board, both that are occupational medicine and even some that are from the other specialties. So that should be at the front desk of, again, those patient safety initiative approved sessions here at AOHC. The occupational medicine directors, Denise Kessler, as I mentioned, is occupational medicine. She's chair. The vice chair, Eric Wood, and Jeff Levin are the other 2 OCMED directors on ABPM. Hi, Eric. Is Jeff in here? Okay. and then just some questions. And before I open to questions, I'll turn this over to Bill. Do you have any comments, corrections?
No? Go ahead with questions.
Yeah, please start. Is the microphone on? I think now it's not.
Well, it should be.
Look in the back of the room.
Okay, I'll speak.
Back of the room.
Now we got it.
Hello?
Yeah, they
Okay,
turned it on.
just the slide went by very quickly. If you don't recertify within the 10 years, the requirement is that you take the exam with all the other requirements, but there's no. You just take the recertification exam. You don't take the whole thing. Is that right?
That's partially correct. So whatever was not so if you don't complete within the 10-year period, in order to become certified again, you have to meet all the requirements that you should have met during the 10-year period, plus any additional requirements due to any changes at the time at which you do recertify. So if you don't do it for 5 years, say, there may be something different that's changed. So you have to meet the requirements in the year in which you're recertifying. If if you miss it by 6 months or a few months, then it's just a matter of making sure that you've got all the Part 2 credits, the CME, the MOC, the exam, and the Part 4 component. And if it's just the exam that you didn't do within the 10 years, say you were up this year in 2016, and your certification ended January 31st of 2016, well, we give the Part 3 mock exam 6 times a year at specialty societies like ACPM, AOHC, ACOEM meeting, also other specialty societies throughout the year, and that's all listed on the ABPM website, so you can go to any of those 6 and take the exam, and if that's the only thing you were missing, the point at which you pass the test, then you would become recertified at that point. We would then report you as, certified as of that time. Your end date is still going to be ending January 31st, 10 years later. So it may only, if you certify 6 months late, for example, then your certification will run for 9.5 years, because the end date for all certifications is January 31st, regardless of when you start. But you'll have a small gap of just a few months. That'll be reflected on the ABPM website. It's not up in red flags and flashing lights. It's just that here's a 10-year period and here's another 10-year period. So it's just the way it's listed.
Okay, so the first part, the preventive medicine part of the original certification never has to be repeated. Is that correct?
Correct.
Okay, thanks.
Yeah, and the mock exam is 2 hours, 100 questions.
Right.
Could you elaborate on the patient safety component?
Yeah.
Eric, would you mind addressing that, because you're the one who's really, the patient safety questions describe the patient safety component of the boards. The question is that I mentioned that there's a new component now on the certification, which is the patient safety initiative. This is something that ABMS is requiring all the specialty boards to do, where we look at how do you take appropriate continuing education in patient safety. So it's identifying those educational pieces that meet the patient safety. Now, occupational medicine is different because, our patients are not always the ones standing in front of us that we're prescribing medications to. So it's really trying to find the definition and criteria for which of these educational sessions meet patient safety. That was the question.
Yeah.
Did I want to elaborate at all? Or?
So, as you mentioned earlier, too, I think there's 6 or 7 sessions here at the conference that people can attend and make that qualification for MOC. Specific time in terms of hours of credit that these classes have to take. The new certificate holders, you have 2 years to get that. The rest of you have to get that in 10 years.
Yeah.
And there's no specific thing you have to have 5 hours, 10 hours, 20 hours. It's just you have to complete a patient safety session.
And how do we find out which courses here are really the
There's a sheet at the registration desk that is listed. And now, again, the other thing is if you're already booked and you can't get to any of those sessions, you can get the tape on it, and that will also meet the criteria. So you can get the CME either way. Yes.
So we can just go on, and that covers us.
That's right.
For now. Yes.
For those of us that are board certified in occupational medicine and grandfather, any of these requirements apply?
You were grandfathered. Okay. The question was, if we're already board certified in occupational medicine and we're grandfathered, would that mean that you were certified prior to 1989? I think.
98.
98. I forgot.
Yeah.
1998. You are not required to recertify. Let me finish this one. You are not required to recertify. However, and this is true for every single medical specialty, if you are not involved in medical certification, if you're not doing the recertification, if you are not doing the lifelong learning, the certifying body is obligated to list if you are not participating in MOC. So you don't lose your certification, but your designated is not participating in MOC, and for some states, that may have some implications. Yes.
Sorry, I'm coming to the mic because no one can ever hear my questions, but the booklets that you have to fill out for the MOC questions, that has to be done at every conference that we come to, or is it before the end of the 10-year period, or what?
The way the MOC works is you take your booklet,
I'm going to take your
you
microphone.
answer your questions. Sorry?
Your microphone.
Oh, my microphone. Okay, I forgot.
Or-
I'm going to just do this. All right, I'm back. The way you handle the MOC booklets at this meeting, at a component meeting, at any session, has to be at least 3 questions per credit hour. You answer the questions. You then submit a statement that you have completed the MOC requirement. It doesn't really matter when you send it in or when you do it, but you send in the statement. You do not send in the questions.
Sorry, one more thing then. So are the questions then, is it the same set of questions that will always be there, or is it tailored to every
And
event?
they're different. Are the MOC questions always the same? The MOC questions depend on the session. Now, some sessions, I'll be honest, the how to become a fellow session, I pretty much use the same questions every year. Okay? The commercial driver session tomorrow morning, totally different questions every year. So the booklet is new every year, and yes, if you attend the same session year after year after year, you can claim credit on it year after year after year because there may be different information.
Thank you.
Other questions? Yes.
If you take the recertifying exam, you don't pass,
Can you retake it?
is there a waiting period?
No.
No.
You can take them 6 times a year if you want. But
The question was, if you take the recertification exam and you don't pass, can you retake it? The answer is yes. And again, no waiting period. You can take it 6 times a year if you want to. You got to pay for it each time, but you can take it each time. Yes.
I was wondering if you'd be able to describe what the special pathway would be to, if you're already board certified in occupational medicine, how to become certified in addiction medicine?
Okay, well, addiction's going to be a little bit different. Okay, we have not yet put together all the criteria for that path. Okay, there will be criteria for addiction medicine. There will be a practice pathway initially that will eventually close, just like the old practice pathway, the alternative pathway for occupational medicine. How it's going to be handled, we don't know yet, but watch ABPM's website. We'll be sending information out, and I suspect we'll be communicating through ACOEM as well.
So the special pathway, so if you're initially certified in one of the 3 specialties, aerospace, OCMed, public health, GPM, you can get a second certification in the first 7 years after your initial certification by only taking the afternoon specialty portion of that second specialty that you're now practicing. You have to have 2 of the previous 5 years in essentially full-time practice of that. But if you do that within 7 years, you only have to do the afternoon. If it's more than 7 years, you're required to also take the morning session.
Yeah, the other thing that's different, you mentioned addiction medicine. There's the specialties, occupational medicine, aerospace medicine, public health, and general preventive medicine. That's core in the morning, specialty in the afternoon. Then we have the subspecialties, very different formats. So medical toxicology, undersea hyperbaric, clinical informatics, and addiction will fit into that as well. It is not the same kind of pathway.
Yeah, there is no special pathway for the
No.
subspecialties. It's only the specialties, the 3 specialties.
Right. But depending on what you're doing, if you're practicing, addiction medicine in an occupational medicine setting, then you might be eligible that way to apply. And the information will be coming out. It's not ready for prime time, even close yet.
It looks like the MOC's changed the way that they do this now from the last time. You need more than the signature on the front. It says you need to also list your answers on the back.
Right.
So it's both now.
Okay, then I did not know they changed that.
Yeah, I noticed in the way that Mary Lund, who's heading this up for ACOEM, so this is the most efficient way that they've determined to set it up. So you sign one piece of paper, there's one piece of paper, it goes into ACOEM, it's got all your information on it, it's much more efficient for them to handle it. So you need to put your answers to which session, your answers to the questions, and then you turn it in. I'm not sure they're checking as to whether you get them right or not, but they want your answers.
And the answers are in the back of the book.
There may be some answers in the book that I'm not sure, but
the answers may be in the back of the book. Yes.
Are there any plans to computerize the part 3 recertification exams that you take over?
The question is there any plans to computerize Part 3 so they can be taken more conveniently?
That would be nice. There's a couple of competing issues, quite frankly. One is that in order to do a computerized exam, if you go to a testing center, is you have to have enough people to make it worthwhile. And, for example, this morning, the MOC exam that was given, there were a total, I think, of 29 OM people who took the exam and 1 GPM. So for that small a number, you wouldn't do it through a testing center. It would be cost prohibitive. On the other hand, if we give it 6 times a year at specialty societies, and we give any of the MOC exams at any of the specialty societies, that gives individuals 6 times instead of 1 time a year to take the exam if they don't pass it. It also gives them 6 locations to go to. So.
The intent is not going to be that you can test at home.
Yeah, if somebody lives, in Chicago area, they can drive in and they don't have to pay for a hotel or anything. Or we do it in San Diego for the West Coast people. So, giving it throughout the country really cuts down on expenses for people overall.
But again, it's not a take-home test.
Yeah, it's a proctored exam.
Other questions? Yes. Okay, well, again, we'll put the stats up for this year for the reference group. First-time test takers, U.S. or Canada trained, U.S. or Canada residency trained, 97%. Overall pass rate was 85%, which included everybody. That's people do. If they study well, they do well.
It's very high. It's in the high 90s, the very high 90s.
Let's put it. It really does test core essential knowledge. It is not meant to be tricky. It's not over 100. It is definitely not over 100.
It's not over 100, and people do fail. But
yes,
it's a very high percentage.
Like I said, people who don't even bother looking at anything will fail. As long as you make sure you understand the essential knowledge. Don't spend 5 million hours studying for it, but don't spend 3. For the Part 3, is there a study guide for the MOC? It's really the same references, but it's not going to be to the same detail. Yes. Yeah, the reciprocity. Eric, do you mind me putting you on the spot again? Eric's our chair of our MOC committee. The question is about using the MOC from other specialties. If you're board in internal medicine or family practice, can you apply that to your requirement for? Okay.
Part 4, you can, if you complete Part 4 for internal medicine recertification, on the website there's a attestation statement that you can use that you can also apply that to ABPM.
Part 2 up here, 45 hours can be non-ABPM approved.
Yeah. So there's a CME component to Part 2, and then there's a MOC component. Of course, MOC also has to be Part 1 of CME, but the MOC component of Part 2 must be approved by ABPM. And ABPM has delegated to ACOEM, for example, and other specialty societies that they can designate, sessions, and this has been worked out over 10 years, so ABPM is comfortable in doing that delegation. And then for the CME, it can be any kind of CME.
And the other thing is with the CME is a lot of the government CME programs are almost automatically approved. And then a lot of the universities will also submit modules and training programs that we approve as well. Other questions? All right. How many of you are going to apply for the boards this year? Oh, come on. You got to give me more work than that. If you have any questions, again, abpm.org. Bill's here. I'm here. Eric Wood, if you can stand up and wave. He's one of the other trustees, and then Denise in the back of the room. We'll all try to answer as many questions as you can. Good luck. Get certified. Stay certified.